We are very, very excited about what pharmacare passing in the Senate will mean for Canadians. This is something New Democrats have long fought for. This is a generational fight. And to give you a sense of what it means for us, why we're so excited about this, why this is such a pivotal moment, I want to tell you about Linda, a woman I met in Port Moody. Linda's a senior. She's someone who's lived with type 1 diabetes. She got it later in life, in her 20s, and has had it, of course, her whole life. And she told me that she had to pay out of pocket, despite having worked her entire life, having coverage her entire life. She's always had to spend money out of pocket. And even now as a senior, despite having some coverage and some provincial and federal programs that she can apply to, she still has to pay out of pocket, and she's still paying about $3,000 out of pocket. She has spent that and then some throughout her whole life. So for over 40 years of dealing with this illness, she figures she spent over $100,000, $120,000 just to stay alive. She remembers when she couldn't afford to get a glucose monitor, or when it's something that was available for her, fainting regularly, and her husband rushing her to the hospital, and she would faint a couple times a year because of her blood sugar levels, and getting stabilized in an emergency room. And when she talked about what pharmacare would mean is, one, she would never have to worry again about the cost of her diabetes medication. But secondly, she thought about how much it would save the healthcare system not to be rushed into an emergency room for those who couldn't afford the devices that they need. This is going to be life-changing. And so we're so proud that we're able to move forward now, and we're going to urge the Liberal government and Justin Trudeau to immediately get to negotiating with provinces. This could mean free diabetes medication and devices for millions of Canadians. This could mean free birth control for millions of people across this country. This is, again, life-changing stuff and just a starting point for what we want to achieve, which is pharmacare for all medication. But we're incredibly excited that we've got to this point. We know that now the Liberals, we forced them to go this far. We're going to force them to negotiate with provinces quickly and get deals signed. And we also know that Pierre Poilievre and the Conservatives, even to the last moment, right now in Senate, Conservatives are still trying to say how this is a bad idea. We know that Conservatives want to cut this. They don't believe that people living with diabetes should get their medication covered. They don't believe that women should be able to have access to free birth control. But we're going to keep on fighting to make sure that this is realized for people across this country. And I'll do that again in French, and then I look forward to your questions. Donc, aujourd'hui, on est tellement fiers parce qu'on est tellement proche à réaliser le projet de loi pour la science médicaments. Et ce que ça veut dire, si je donne un exemple de Linda, c'est une personne âgée que j'ai rencontrée à Port Moody. Elle est diabète. Elle était diabète depuis elle avait 20 ans. Et pour toute sa vie, elle a dû payer de sa poche pour les médicaments dont elle a besoin. Et elle a dit que c'est à peu près au minimum $3,000 par année qu'elle a dû payer. Ça veut dire depuis le long de sa vie, elle a dû payer plus de $100,000 juste pour vivre. Juste pour vivre. Et quand j'ai dit que qu'est-ce que ça veut dire pour vous si on a une assurance médicaments qui inclut les médicaments pour la diabète, elle a dit que ça va enlever beaucoup de pression pour moi, mais ça va aussi sauver d'argent pour notre système de santé. C'est quelque chose qui peut changer vraiment la vie des gens. Donc, on est tellement fiers de ça. On a forcé les libéraux et Justin Trudeau de mettre en place ce programme. Mais jusqu'aux dernières minutes, on voit que les conservateurs essaient d'arrêter ce programme, de dire non à ce programme. Je sais que Pierre Poilievre et les conservateurs veulent couper l'assurance médicaments. Ils pensent que les gens, les diabètes, ne méritent pas d'avoir des médicaments gratuits, que les femmes ne méritent pas d'avoir les contraceptifs gratuits. On va continuer de se battre pour vous. On est fiers de ça et on va continuer de mettre la pression sur le gouvernement libéral maintenant, de négocier avec les provinces et territoires pour avoir des ententes pour réaliser ce programme. Merci. And with that, I'm ready for any questions you might have.
Vous entendre sur le gouvernement du Québec qui a reculé et qui va offrir le programme de soins dentaires dans les établissements publics.
C'est une victoire pour les personnes âgées. On a soulevé cette question. On a présenté notre colère. J'étais ici avec Alexandre Bourris. On a dit que c'est injuste. C'est une décision sans cœur de dire non aux personnes âgées qui habitent dans un CHSLD qu'ils ne peuvent pas avoir accès à ce programme. Donc, je veux dire que c'était une bonne décision que Premier ministre Legault a changé sa décision. C'est une bonne chose à faire parce que ça va garantir que les personnes les plus vulnérables peuvent encore avoir accès à ce programme vraiment important qui va encore changer leur vie, qui va donner des dignités aux gens qui ne peuvent pas accéder les soins dentaires sans avoir un programme comme ce qu'on a forcé les libéraux de mettre en place.
The BBO's report today says that the industrial carbon pricing scheme is not only less costly, but it reduces emissions significantly more than the consumer price. What's your response to that?
Well, we have raised this concern that we know that the industrial price on pollution is something that works. But if you look at what the Liberals are doing, they're letting big polluters off the hook, even still. They're letting them off the hook. They're giving them massive subsidies, and big polluters are not paying what they owe. And so I've raised this concern I've raised this publicly, saying that the Liberal plan is problematic because it doesn't actually go after big polluters. And I've said that Pierre Poilievre's and the Conservatives' lack of a plan, their plan is basically to say big polluters should pollute unlimited. Both of them have it wrong. We need to make sure that big polluters pay. We need to make sure workers are respected. We need to make sure that we are building a plan that helps us reduce our emissions, and that should be the focus.
Do you think that finding means that we should get rid of the consumer side and focus more on the industrial one?
Well, what I've said is that we will have a plan, and we will present that plan when it's ready. But our plan is going to be one that addresses the weaknesses of both the Liberals and the Conservatives. Both Justin Trudeau and Pierre Poilievre have flaws. Justin Trudeau has not gone after big polluters, and Pierre Poilievre wants to let them pollute unlimited. Both of those approaches are wrong. We're going to present a better plan.
Pharmacare motion, if now that business is stalled in the House because of this privilege motion, if the Liberals were to introduce a motion of closure, is that something that you would vote for and support?
Right now, we've said, and I've said this a number of times publicly, that the Liberals should release the documents. The Speaker of the House has ruled that they should do so. They should release the documents. We want to make sure the government is held to account. They should release the documents, and we can move forward.
So is that no, yes or no on a closure motion? Would you vote
We will
for
look at that motion when it comes before the House, but right now our focus is on the government releasing documents. That's actually the barrier here. Sure, the Conservatives are playing games. They've been doing that from the beginning. They have no interest in seeing Parliament function. That has been their role from the beginning. They don't care about people or Parliament functioning. But the Liberals in this case also need to show some accountability and release those documents.
Pharmacare has passed through the Senate. Is that changing your calculus at all and potentially triggering an election, seeing that your chief legislative victory is now law?
Well, this is a huge victory, and I just want to highlight how big of a victory this is. I'm going to ask Peter to talk a bit about the work that went into getting to this point and how big a deal this is for New Democrats. But again, this is a huge piece. The next thing is we want to see people actually get the benefit. So we want to see the Liberals negotiate with provinces. Some provinces those negotiations have already started, and we've already seen some positive steps, for example, in British Columbia. We want to see this move forward. I want to see everyone in our country who has diabetes get access to diabetes medication and devices. I want to see everyone get access to free birth control. That's the next step now. But I'm going to ask Peter to talk a bit about what this means as some of this more kind of...
Right?
I think he did. But I do want to underscore how important and how historic this is. The Senate will be voting on tonight. And this is very exciting for people like my constituent, Amber, who's paying $1,000 a month for diabetes medication. I mean, that is unbelievable, an unbelievable burden. And as the Canadian Federation of Nurses Union points out, we lose hundreds of Canadians every year because they can't afford to pay for their diabetes medication and devices. So this is indeed a historic first step. As Jagmeet says, it is vitally important that the government now proceed to signing the agreements with the provinces that have indicated interest. British Columbia has already signed a memorandum of understanding. Manitoba is interested. Other provinces are interested. We need to make sure people can get the benefit from this. Et j'aimerais dire, il y a 3 ans et demi, j'ai présenté le projet de loi sur les assurances médicaments qui a été battu par M. Trudeau et l'ensemble des libéraux et les conservateurs aussi. 3 ans et demi plus tard, on enfin met en place un projet de loi, un système qui va aider les gens, surtout avec le diabète. C'est parfois 1 000 ou 1 500 $ par mois que les gens sont obligés de payer. Ça va être très historique et ça va être extrêmement important Well, 3.5 years ago, I presented the bill on pharmacare in the House. Justin Trudeau and the Liberals voted against it. So did the Conservatives. 3.5 years later, because of the work of the NDP caucus and our leader, pharmacare, that first important step, becomes a reality in this country, and that's cause for celebration, particularly when you think of the number of lost lives, as the Canadian Federation of Nurses Union indicates, the fact that we lose so many people every year because they can't afford to pay for their medication and devices.
So does this change the political calculus for you, though, now?
Well, as I said, the next step now is we want to see agreements signed. So our priority now is going to be to focus on getting Justin Trudeau and the Liberals to sign agreements with provinces, because while the bill being passed is a big deal, we also want to see people get the benefit. We want to see people get free diabetes medication, free birth control. So that's going to be our next focus.
Right now.
Ça veut dire que vous avez encore besoin du gouvernement libéral au pouvoir pendant un certain temps. Des négociations, c'est pas quelque chose qui se fait en une journée.
Comme on a dit depuis le début de cette nouvelle situation, on va prendre chaque vote et décider comment on va voter. Mais oui, c'est important pour nous maintenant de garantir que les gens reçoivent le bénéfice, l'avantage de ce projet de loi. Ça veut dire qu'on va exiger le gouvernement libéral de signer les ententes, de négocier avec les provinces et les territoires pour réaliser le bénéfice de ce projet de loi.
Have you asked for anything from the Liberals to say that you'll give them their support going forward if they meet some new demands, so that way they don't have to rely on the Bloc Québécois?
No.
You haven't asked for anything from
No.
them?
We did hear from the House Leader, who did say yesterday or earlier this week that the Liberals are in discussions with the NDP on supports for seniors. So is that happening, and what is your ask when it comes to that issue?
That is not happening. The ongoing discussions with the House Leader, that is normal, but there's been no discussion between me and the Prime Minister. There's been nothing I've been putting on the table, nor has the Prime Minister put on the table. I've said very clearly, we're not looking for a new deal. We tore up the agreement. There will be no new deal. We're not negotiating a new deal. There is nothing of that nature going on. We have said the House leaders are having conversations, and they're having discussions as they normally do, but there is nothing in terms of any discussions between, at a party level as me as party leader, with the Liberals. That is not happening.
Ça veut dire que vous n'avez pas parlé à M. Trudeau. C'est quand la dernière fois que vous avez parlé à M. Trudeau, vous, personnellement?
Je ne sais pas si c'était longtemps.
Depuis le moment où vous avez annoncé que vous déchiriez l'entente, ça, vous l'aviez fait par
Avant de ça,
courriel.
parce que oui, c'était par... Oui, avant de ça.
More you want for seniors, Mr. Singh?
Oh, we want lots more for seniors. We want to make sure we ran on the idea of lifting seniors out of poverty. Seniors right now in our country can barely get by. If you look at how much they get with OAS and GIS, and for many seniors that can't actually access CPP, I mean, it is far too low. During the pandemic, we said people need at least $2,000 a month to be able to get by. Well, seniors aren't getting that with OAS and GIS. How are they getting by? It's impossible. So yeah, we want to see seniors get more supports. We actually campaigned on the idea that seniors should receive a livable guaranteed income so they can live with dignity and respect. And so we want to see increases to the amount that seniors receive without a doubt.
On the topic of drug prices, sir, today Pierre Poilievre said that he would support involuntary treatment for minors and prisoners. Chrystia Freeland said there has to be some recognition that sometimes people are too sick to know that they need treatment. What is the NDP's position? Would you support involuntary treatment for people who are going through drug issues?
In general, the approach that the Conservatives have taken, I think, is in a complete lack of awareness of the experts, a lack of a recognition of the evidence. And so what I would look to for any guidance around what is the best way to help people that are in desperate need is to look for the expert advice. What is the best practices in the medical community? What are the best ways to help people that are struggling? I want to really make sure that we're making our decisions based on two principles: compassion. We care for the people that are struggling in our communities, that are dealing with drug addiction, who are dealing with overdose crises, people who are dealing with mental health problems. The first step has to be compassion, and the second is we have to make sure it's based on evidence, based on good, solid evidence of what is the best way to get people the best treatment possible. Merci, thank you so much. Merci.
Why aren't you asking for the Liberals for anything?